welcome, friends, and thank you for tuning into the Optimal Health program today. I hope you're doing well. A lot of good information that we can chat about besides taking your questions. Of course, that's what we're here for, so we'd love for you to give Frankie a little shout, chat with him, and we'll get your question up on the air. We have a whole bunch from people that have emailed the website, so we can certainly go over those. To cover a couple of topics right off the bat, get you ready to call in. There's always been a question of what diet is good, what diet's bad, what to do, blah, blah, blah. So here's an interesting article, Medical News Today, talks about looking at 3 different diets, the Mediterranean diet, which we're all a big fan of, the DASH diet, and the AHEI diet. The DASH dietary approach is to stop hypertension, reduce the salt, have a little more magnesium, potassium, pretty much. AHEI diet, Alternative Healthy Eating Index, where you use a scoring system. You have all sorts of fruits and vegetables and grains and nuts and seeds. It's all very nice, but if you're trying to see a difference in diabetes, you can't have the grains, just common sense. You can't have the high sugar fruits, common sense. So all of these diets really fall short because they're still keeping foods in that are giving you way too much sugar and will keep your blood sugar elevated and try to get your body to work harder, and it can't really do that terribly well, to be able to burn that sugar down. So even though people are starting to give new names to all sorts of different diets, of course, Mediterranean we like, and that's been around forever, they're still too high in carbohydrate. I don't understand why they don't get that. And my comment has always been, we'll make a diet based upon you. So if your sugars are high, we don't want you to eat all the sugars, the bread, the rice, the pasta, the oatmeal, the grains, the regular fruits. Just cut back all the sugar foods. And your blood sugar starts to come down just by decreasing your intake. Kick up the exercise, fix your vitamins, minerals, hormones, etc. And even just that can make a very big difference. So sometimes, and I'm not sure why, another name comes along for a diet, but it still has too much carbohydrate on board. Kind of drives me crazy a little bit. We talk about exercise all the time, and last week we were talking about exercise, and there are patients that have questioned exercise when you have neurologic issues. Well, here's a great study talking about cycling may help to restore neural connections in patients that have Parkinson's. You know, I keep telling people, do activities so you're asking your brain to respond. The new study has found that cycling helps restore neural connections damaged by Parkinson's disease. The benefit was seen in as little as 12 cycling sessions over a 4-week period. Brilliant. And I agree with this. I've been saying this for the better part of 30-some-odd years. Dr. Asaf Sheikh, MD, PhD, professor and vice chair of Research Education Center, Neurological Institute of University Hospitals of Cleveland Medical Center, blah, blah, blah. How do you put that on your letterhead? It's just too many words.
Oh, yeah.
This doctor's the head, and at any rate, the brain is a dynamic and ever-evolving system. You want to have the best stimuli, a lot of oxygen coming in. That's what exercise will do, flood your cells with oxygen. It will deliver, but the study says nothing about testing you for vitamins, minerals, and hormones. Great vitamins, minerals, and hormones, which we create from our blood test and our recommendation. It'll help to get rid of waste products of metabolism. When they did the study, they had people with Parkinson's that had deep brain stimulation devices where they put these wires into your brain to try to give you some stimulus. And they're able to read and trace how much increase in brain function occurred from the exercise. So it was very significant. My other comment is that if you look at things that we know damage the brain, like heavy metals, and you start to get rid of them, that's a big benefit as well. Because you can't think that, lead, mercury, nickel, cadmium, arsenic, aluminum, there's 21 metals that we're exposed to, which we do a urine test for, which is the most accurate. You can't think that these things in the environment are just okay and, ignore them. There's so much about this. There's tons of research on this, millions of studies. If you look at metals and all the individual metals, aluminum is directly correlated with dementia, memory loss, and Alzheimer's. And if they were to look at aluminum for Parkinson's and the other diseases, you're going to find it because metals are just all damaging. Apparently, the metals get into your substantia nigra, the dark part of your brain, and damage your ability to make dopamine. And they also wipe out the ability to make glutathione, which is important as a free radical binder, to stop some of these things from damaging your body. So you have to look at all of these things. Also, to go back to the diet, if you're just talking about 3 different types of diet or food intake, and you're not talking about correcting vitamins, minerals, hormones, exercise, you're missing out on some of the more significant parts of that correction. If we talk about stem cell therapy, putting brand new cells into your vein to go to your organs that have damage, and they'll go to where you have damage or degeneration, that's the biggest benefit because you're putting new cells in your pancreas that are brand new cells that will make insulin. You'll see your C-peptide level, insulin levels come up. So it's not just about one diet's name or another diet's name, not just about cycling and not testing for and correcting nutrients and hormones. There's so much and heavy metals, there's so much you have to talk about. That's why you have to look at some of these studies to say, that's a great part of the picture. Now let's look at the rest. So that's what I've always thought of, and that's what I've always done.
Got a question here. Rumbler asking, what's the right amount of carbs an average adult should be eating in a day?
Depends upon activity, depends upon age, depends upon blood sugar levels, depends upon cholesterol, triglycerides. So it's not as though everybody should have X, what we're told. Oh, your food pyramid, which was the biggest lie of all time. I was going to make a comment on somebody who didn't kill himself, but I don't know if I should or shouldn't. If you're a kid, you could have more carb because your hormones are great, you're doing tons of activity, you're burning through everything, and you have no ability to raise your cholesterol, triglycerides from eating the carb because your body's young and vibrant. As you get older, you start to see the cholesterol, triglycerides rise, or blood sugar A1C starts to go up, or you're gaining some weight that you don't want. You got to cut the carbs back. In a 20 or 30-year-old, if that starts to happen, you might just cut them back a little bit and you'll be fine. The other thing is when you're eating too much carb, your blood sugar goes up, you're secreting and releasing more insulin, your blood sugar drops, you crave carb. You want to stop that craving. So when you tighten the carb intake, you're not raising the sugar quickly and then dumping the insulin and lowering your sugar and craving. And then people crave alcohol too in the same breath because the sugar of the alcohol will do that. So there are a variety of reasons we want to tighten the carbohydrate intake. And in doing so, you're decreasing the low blood sugar after the meal, the hypoglycemia. You're decreasing the way that sugar excess, whether it's from 1 or 10 or 1,000 meals, can start to affect inside your cells, glycation, nerves, blood vessels, etc. You're allowing your body to burn cholesterol and triglycerides and the LDL far better. You're keeping your body fat percentage in a tighter range. So there's a lot of benefit from keeping the carbs to a tighter range. When people come in that are 60 or so and have very high cholesterol, triglycerides, they're on meds, they're diabetic, that's all part and parcel of years' worth of carbohydrate excess and probably years' worth of inactivity, years' worth of hormone decline. So we can talk about it, the situation from any picture or angle we'd like over time. I call it a continuum. And the reason why diabetes and high sugar and cholesterol and overweight is rampant here is for these reasons. We're told to eat a ton of carbohydrate by every commercial that's on TV for breakfast food and lunch foods and sandwiches and pizzas and, over carbohydrate everything. And restaurants here will put bread on the tables, as soon as you get to sit you down. Even before they sit you down, the bread's there. So
it's hard to fight it.
It's this, sort of brainwashing of over carbohydrate intake. And if you have a person, like many people have done over many years, that's been having carb for breakfast, lunch, and dinner since childhood, sooner or later, your pancreas is going to get tired, and those people will become type 2 diabetic. Wow. Some can become type 1 diabetic. But if you start to understand this and you keep changing it, keep the exercise there, correct everything, vitamins, minerals, hormones, then you can change and reverse the process. So, not to beat around the bush, but to get to the point around the question with how much carbs should people have, if you really need to burn down your weight, your sugar, your cholesterol, your triglycerides, your LDL, if you want to keep your appetite tighter so you're not craving, you may want to get to 30 grams of carb per day. So you're burning that all down. When people do that, they bring their weight down and they're in the right zone based upon their blood tests that we do. I'll say, okay, go to 40 grams a day and see how you do, or 50. And a lot of people hover between 30 and 50. And if they go to 60, and on a weekend they go to a wedding or some sort of function, they have too much, then they go back to 30 again. So you can go back and forth between the 30 and a little bit higher. And if you do that, you're keeping the balance as opposed to going to 100 grams every day or more, and you're creating a big problem for yourself.
The chat is learning a lot.
Cool.
That's what we like to hear, guys.
You know, and this is all born out of, initial consult, physical exam, really thorough big blood test, recommendations, recheck, documenting, improving. So I hear myself saying the same things over and over and over again for 39 years. But these are the best paragraphs to describe what to do and how this works. And many thousands of patients over that period of time, we've done the same thing with the tightening of the carbs, correcting vitamins, minerals. So I know it's going to happen. I know if a person's doing the exercise or not. So if I have to give them a little bit more of a push to do the exercise or try something different, whatever we have to do to get the result. Okay, what else do we have here that's interesting? MS is a devastating disease, and there are studies that talk about MS taking years to evolve and years to start showing where a test would become significant and give you that documented diagnosis. It says that subtle signs of MS may occur over the course of about 15 years. And when they tracked MS patients, which is great research, they looked to see that these individuals had far more medical visits than other people for odd things, for neurologic symptoms, twitching, this and that. Compared to individuals that don't have MS, their doctor office visits were dramatically higher. In the 8 years before MS, the visits tended to be pretty high, and at 7 and 5 years, the greatest spike was seen in right before the MS diagnoses. These are visits for ophthalmology, nervous system-related doctors, appointments and complaints. Musculoskeletal problems were 5 years before. At year 4 and closer, the visits were really more neurologic issues, difficulty with walking, numbness, tingling. So interesting to see that 15-year time frame is there. What that tells me is that doctors should be questioning patients that have neurologic symptoms a great deal more and kind of getting a little bit more information on it. Do a nerve conduction test. That's without any needles. You're just looking to see if the nerves are slowing down. MRI of the brain. We do that for people that have problems with memory, focus, concentration, of course, if they've had a stroke or a significant neurologic issue. But you may want to start talking about this to patients, because if they're going to develop that MS, you'd rather find out sooner than later. I test everybody for heavy metals, and heavy metals are linked to all the neurologic disorders. So the MRI of the brain would be a great way to do that. I send people out for neurologic visits, and certainly, a person comes in and they're 80. I may have them go see a neurologist to look at a neurologic evaluation, nerve function, also memory, focus, concentration, the mini mental status exam where people have to draw a clock and see if they can draw a perfect or as close to perfect circle and put the numbers in the right places. Some people who have enough change in their brain, it's not really a great circle. It's oval, and the numbers are all over the place and not where they should be. So getting some of these tests done early on makes all the sense in the world, because then you can start to adapt and make some change. Whether we talk about doing chelation therapy to help to bind metals, pull them out, or stem cell therapy for the neurologic and the MS patients. So with a lot of this information, it's important to start looking at these things and asking more questions early on, as opposed to letting things go and patients end up with more of a problem.
Someone's just asking, why does MS affect everyone so differently? Some mild cases, some very severe.
So the best way to answer that is to think about your brain being a big fatty organ, and there's tons of neurons that go back and forth to every single part of your body. MS doesn't always hit the same nerves. It doesn't always hit with the same intensity. So if there's damage to one nerve, and that one nerve is something that goes to your handwriting might be off, and you may have numbness and tingling. A lot of doctors might also think that can come from the nerve roots in your neck. So they might think, oh, you have discs in your neck. That could be the cause, and you have to differentiate that. That's important. Some nerves will make it harder for a person to walk. Other areas of the brain may make it harder for a person to have memory or focus or vision. So people think of a disease as coming on sort of like a wave hitting the shore. It's relatively even and come. No, it just doesn't do that. Most do not do that. Or a light switch on and off. Doesn't work that way. So certain areas might be affected early on, and then they can get worse and worse, and you have to track that. That's what the doctor should be doing in conversation, and doing appropriate testing specific to that. But as they say, everybody's different. So let's say the MS is contributed to by some heavy metal exposure. Some people have a ton of exposure. Some people have a smaller amount or lesser exposure. Same thing with dementia and memory loss and Alzheimer's. Some people have a lot of aluminum on board, because we test for that in blood and urine. Other people have less on board. So there's so many variables. We just need to include all the possibilities when we try to understand why that disease is occurring. So also, viruses like Epstein-Barr are linked to MS and lupus.
That was the next question.
So Epstein-Barr is a nasty bug. 90% of the world, the whole world, has been exposed to Epstein-Barr between kindergarten and college. That's what literature says. I thought it was 95% of this country, but apparently it's worldwide. So it's the most common bug in the world. It's in the same family as herpes viruses, herpes 1, 2, cytomegalovirus, herpes 6. Epstein-Barr is a weird bug. If you've never been exposed and it hits you, typically hits you hard when you're a kid, you're home for a couple of days, a week from school, sore throat, swollen glands, kissing tonsils, it's called mono, etc. Very easy to spread around. But if it's there for a long period of time, we know that it correlates with MS, lupus, at least 24 cancers, Alzheimer's, Parkinson's, ataxia, meningitis. The literature is, I have this literature up on the doors, of the cabinets in my exam room, so people can sit there and look at these things and take pictures and start to do their own research on it. So I love for people to constantly look at some of the articles that I put up there so they can see and, research further. We've heard that there are viruses that cause cancer, papillomavirus and cervical cancer. So why would it be unusual that Epstein-Barr is linked with Burkitt's lymphoma, head and neck cancer, all sorts of things? Epstein-Barr has a protein called LMP1, latent membrane protein 1, that inhibits your immune system and makes it easier for your immune system to falter in fighting it and other things. Crazy but true. That's why we test for these things. And sometimes we retest. So if a person's got 2 antibodies to Epstein-Barr and they feel achy and flu-like, okay. If there are 3 or 4 antibodies positive, that's just confirming the diagnosis immediately. But some people will have prior exposure, which is usually 1 antibody positive and the others are negative. And that individual could be re-exposed, and all of a sudden 2 or 3 or 4 antibodies pop. And, you want to be as diligent as possible in making the diagnosis. There's also a new PCR test for Epstein-Barr, which we've been doing. And one of the therapies that we do, because there's no drug for Epstein-Barr, is vitamin C IVs. And there's a lot of literature showing that intravenous vitamin C can help inhibit viruses. as well as helping to inhibit cancer. So if you go on Google Scholar and look up intravenous vitamin C therapy there's probably 1.5 million, maybe 1,600,000 studies on intravenous vitamin C. I tell people every day, go to Google Scholar, read this. You'll see the same research that I do.
Question regarding what if you're using stem cell to treat MS?
Yes. Oh, yeah, of course. So the protocols that were created, and I certainly have not been the first person to get involved in this, and years ago when I got into the protocols and the clinical trials, MS, Parkinson's, Alzheimer's, liver, kidney, heart failure, lupus, rheumatoid, diabetes, joints, all the different things that we've worked with. The treatment and the protocol is to extract the stem after the spin, do an intravenous, and then lay the person down on their back and drip the stem cell liquid with the stem into the nostril one at a time so that you're delivering it to the back of your nasal cavity so it gets absorbed into your blood vessels, into the tissues, and gets into your brain. So that's, been proven by what we've done for all of the brain-related issues, stroke, MS, Parkinson's, Alzheimer's, macular degeneration. So that's the best technique. It's the state of the art to drip it into the nostrils. And we have people that we've done the intravenous and the nasal droplet that have had other issues, and some people have no medical problems and they get great brain benefit from it because you're putting new cells where you have wear and tear. That's what stem cells do. They're designed and they desire to go to areas of damage and degeneration. So, and I tell people, look at the videos on the website. You'll get a great exposure to that. drcalapai.com is the website.
We do have a clip from that website we will be playing.
That's true. We have a gentleman who's a big jiu-jitsu guy that hurt his hip.
Have you recovered?
Yeah, he won his competition. It's a few months later. So, yeah, we'll get to his video in just a bit. Any other questions?
Well, I was talking about your lip.
Yeah, my lip's fine. I have black and blues. My instep hurts a little bit still. Because when we spar, we spar.
Do you think stem cells will one day replace the expensive drugs people take for MS and other?
It's hard to say. I think the drug realm will always be there in every way, shape, or form. It's the biggest, the most powerful, and they're looking to continue to do what they do. And doctors like to look at that or look towards that as their main therapy or as the education of what has to be done for that disease. It's not often that doctors traditionally go and look for something outside of the box. So I don't think anything will ever stop the drug company mechanism or progression. I think that more and more people will learn about STEM because this has been happening over the past 20, 30 years. 50 years ago, people didn't know anything about it. And now we know the research is worldwide, and there are at least 5 million studies on stem cell therapy if you look that up on the search engines. So the information is there. And people now are becoming more aware, more intelligent. They want to research, they want to look, they want to learn. And they're not sitting back and just saying, okay, I'll take the medication without understanding the full extent, the benefits, the risks, the side effects, etc. So people are a far more educated population now than ever before, and rapidly becoming so, much more so in the past 5 years, much more so. Lots of questions about different things and medications. I had a patient the other day that was talking about using nutrients for this or for that. For example, high blood pressure. Patients on medications doesn't want to be on the meds. He wanted to switch over to a variety of nutrients. I said, well, where's the study that says this nutrient is going to do this or do that, and how many milligrams and how many people are studied? I'm all for that idea, but we have to have an understanding that something says this or that will work. If they have a liver problem, is milk thistle going to help their liver? I don't know. Some comments about milk thistle say it's good for your liver. But how much do you take? Are there side effects? Can you get it where it's purified? I mean, there are a lot of questions. Another question was, these nutrients help to remove plaque from your blood vessels. I'm like, well, show me. Show me research. You can't just say it. And then how much do you have to use? How often do you use it? What diet are you doing with that nutrient combination? It's got to be low carb, obviously. But people will throw out stuff, and unless there's something behind it that has some proof, then I tell them, show me proof before you start to do it, because without that, it's just hearsay. And a lot of people out there that are trying to sell product are just throwing out these comments without any valid proof or research. You've got to have something that says, we took 10, 20, 50, 100 patients, we did this, and this is what occurred, and this is why. And it's reproducible and reliable. Everybody's different. Some people need a lot more magnesium than others, so it's got to be based on your blood test.
Got a question here on they want to know what kind of timeline of improvements have you seen with patients with MS after stem cell therapy?
Like we said before, everybody's different. Some people have a milder case than others. Some people have less headaches. They have better focus, concentration over the course of a couple of weeks. We tell people you've got to give it 6 to 18 months. But usually people start to see something improve over the course of the first month or two. We've had people that have said their color vision is improved, their walking's become better, handwriting's better. So it does take time. There's a great MS video, a gentleman in like a pinkish salmon-colored shirt on the website. He was a principal at a school. He was a big rodeo guy, very strong guy before the MS occurred, and did all his workup, put him on vitamins and minerals, did the stem. And in that video, he describes how the day after he did the stem, and he was in a wheelchair, electric wheelchair with a left-handed switch because the right hand wasn't really working much, couldn't do anything with it. Got out of bed, got out of the kitchen, poured water in the coffee machine, made coffee, put something in the microwave to heat up his eggs or something, whatever it was, all with his right hand, and his wife's looking at him like he had 3 heads.
Wow.
So that's rare, but to have that kind of improvement, there's no drug or chemical that would do that. There's no nutrient that would do that. But when he told me this, the next day, and we had him come back in, and I checked him, I went to grab his hand, and he had good hand strength. It wasn't the way he was when he was a kid, but it was a lot better than it was when he first came in. And progressively, at one point he came in without the wheelchair.
Wow.
Within a month or so, he was able to get up out of the wheelchair. But you can hear his story on that video on the website. And his hand grip strength became so strong because that was his hand that he held himself onto the horse with the rodeo. Great case, great story. Great case.
Whoa.
So everybody's different. That's why we say we'll follow you up in 3 to 4 weeks after the stem. Write down everything that you see from your hair down to your toes. Memory, focus, concentration, word retrieval, vision, smell, color vision, taste, movement, sleep, everything. And that's how we track patients.
Wish I took that video for today.
Yeah, we'll do that next time. Friday, baby.
All right.
But yeah, if you either get on the website or YouTube, he's there. He's got a pink shirt, stocky guy with a salmon-colored shirt.
I'll have him for Friday. Don't you guys worry.
Cool.
If you miss it. All right, we're up to date here.
Okay, let's see what are the questions we have from the website. Hey, Doc, I have fatigue with exercise. This is from John in Bayside, and he can't figure out why. Well, fatigue when you do exercise could be from a few things. Low blood sugar. A lot of people try not to eat and do intermittent fasting. If you're going to do exercise, you don't have enough nutrients or food on board, you may be tired. If your vitamins are low, that'll happen. If your hormones are low, thyroid, DHEA, testosterone, IGF-1, viral circumstance could also make you tired when you're trying to do activity. So we have to look at that. Your B12 could be low. So we've done a variety of things. Once you check all this through blood work, some people will give a B12 shot. Other people will get their D and their C and their other nutrients up to great range. and they start to do the activity, and now they have enough nutrients to draw from. If your nutrients or hormones are low, your body's drawing or trying to draw from it, and there's nothing there for them to use. This is also why athletes, in many cases, hit the wall, because they're working out so much, but their intake is not enough, and they're depleted. And once you get their levels up to here, and they do the exercise, they'll remain at a good range, a good high normal range, because the nutrients are in far greater level. So it depends. Younger people, sometimes they work out so much that they're depleting themselves. A good friend of mine took his kids upstate and to a beautiful property on a lake. It was a friend's house up there, and they're doing all sorts of stuff. Then I guess right before they were going to come back, his daughter was really tired and exhausted and really couldn't function. Brought her to the hospital. She was dehydrated. So she did a lot of activity and swimming. You're swimming and doing all this vigorous stuff. You don't realize you're sweating out a lot of your fluid if there's water there. So the water around you is pulling that fluid away, and you don't realize how much fluid you lose. And it was super hot. It was 100 and some odd degrees. But if you're not drinking at least 6 to 8 glasses of water a day, or those, little bottles of water, or you put your water in a nice steel container, you can get dehydrated. It happens. I'm going to be very careful.
One of the questions were how much water do you think we should drink a day? So you answered that one right there.
Yeah,
Boom.
you need a lot of water. Some people need more. For people as you get older, if you squeeze your skin and you let it go, if your skin stays tented up a little bit, then you need more water. It's kind of an old ER doctor's way of seeing if a person's dehydrated before getting the blood work back. But 6 to 8 glasses, sometimes more. You should try to pull this up. How much water does Tom Brady drink every day? I've had this conversation with friends. Gets up in the morning, he drinks a ton of water. Does these stretchy exercises, plyometrics, with the little bouncy ball, whatever those things are, and,
What?
What does he drink?
I can't even say this. Is this real? Half his body weight, roughly. For a 225-pound person like himself. Yeah, so he's known for taking, according to his book, the TB12 method. He drinks roughly half his body weight in ounces of water daily. So this would be approximately 112 ounces, or about 14 cups. Oh, that doesn't sound, 14 cups doesn't sound crazy, but that's crazy.
14 cups, so 8-ounce cups?
112 ounces.
That's not crazy. And again, realize these guys are doing a lot of exercise all day long.
Oh, and then when he's exercising, he doubles that amount. So, all right.
It seems like way too much, but look, he's never really been injured. Guys that get dehydrated or guys that are too bulky, weight training wise, they get injured. Look at all these guys who are big and jacked up that all they do is weight train. They get injured.
Okay, so approximately 37 glasses of water per day. That would probably kill some people.
Yeah, it could.
Right?
If you're older, not in shape.
Yeah.
But again, you're working out. So these guys work out, some of them all day. I know a lot of them. So I even met him. He's awesome. I met him a couple times. A friend of mine, Rich, who does all the health insurance planning and stuff for a lot of the NFL and the hockey players. He told me to meet him in the city for dinner. I was working in the city at that point. And we walk into a restaurant, and we go into a back room, and there's a whole bunch of like cool people and tall people. And I looked up, I'm like, that looks like Tom Brady. I looked at my friend, and he's laughing. I'm like, dude, why wouldn't you tell me we're going to have dinner with Tom Brady? I was like shocked. And it was great. And Tom Brady's buddy Will was there. A lot of the guys that my friend Rich knows. So we had dinner with the nicest guy in the world. He seemed like he was the kid next door, that you knew your whole life. And then I had dinner with him many other times because of that connection. And the next time we had dinner, hey, Doc, how are you? Gave him like a big bro hug. I'm like, holy crap, he remembered who I was. It's pretty cool.
Drink your water.
Very nice, genuine guy. Yeah, drink your water.
Our chat saying that's too much. It's too much water.
It's a lot of water. I can't tell you that the average person should do that, but it's got to be at least 6 to 8 glasses a day, maybe 10, maybe 12. Especially if you're doing activity, try it and see how you feel. You could always test to see what your body's doing, but your body will do a great deal better if you have a lot of hydration there. For people that are constipated, you get them up 10, 12 glasses of water a day, all of a sudden constipation changes because they were a little dehydrated. And it makes everything, go smoothly.
Oh, the chat.
I've met a lot of interesting people over time, over the years.
I'd say. The chat is not dropping it.
They're not dropping it? They believe it or they don't believe it?
Oh, they believe it. They just think it's insane.
Yeah. Yeah, when I first heard about it, I'm like, really? I don't think I could do that.
Tom Brady changes water to Super Bowl rings.
Yeah, right. Hey, look, he is what he is. He does what he does, and no one else has done it. And every now and then there's someone who stands out that, can do the job. It's unusual, but look, there are people that can do it. Does he owe it all to the water? I don't think so, but, people like that have this work ethic and this perseverance and this drive that is unstoppable. Completely unstoppable focus and drive. That's the number one thing. Genetics have to play a role, and he doesn't work out lifting weights like everybody else in football does. He does plyometrics, which creates strength and stability and stretch so that, if you overstretch, you're not hurting your body. And it is what it is.
Don't hate the player.
That's right. Okay. If you'd like to call in, I know some people like to call, but we haven't seen that in a while. 888-420-9272.
Make our day.
You could like to call and ask a question. I'd like to hear a voice now and then.
Please.
Soon there's going to be AI robots calling in and asking questions.
True.
Hello, doctor. What do you think of AI robots? Oh, I think they're great.
Good, I'm replacing you.
Did you see there was a clip of something in Japan where they were making these actual robots, life-size robots, and, telling them what to do, and the robot just, freaked. And he just broke whatever tether and just kind of fell, but he just went
crazy.
Bonkers, yeah. That's a little scary. Wasn't it where a robot attacked people in a factory?
There are issues happening.
Or maybe I fell asleep watching that Will Smith movie with those robots.
iRobot.
Crazy. Okay, what else do we have? Alzheimer's disease. This is curious. They think that partially it's linked to low brain lithium levels. Lithium is a mineral that can be found in nature in small amounts in the body. It seems to have a neuroprotective effect on the brain. New study shows that lithium occurs naturally and plays a major role in normal brain function. Scientists also discovered that the loss of lithium may be an early warning sign for dementia, memory loss, and Alzheimer's. Very curious. In Alzheimer's, obviously we know that the beta amyloid plaque causes damage to the brain. Is there some potential that lithium binds to that and prevents some of that? That's what they're looking at. And replenishing lithium levels when they did studies on mice helped to repair some of the damage. Lithium orotate. Very interesting. That's why we constantly look at your blood test for vitamins, minerals, hormones. Metals, get the metals out, get the vitamins in. The vitamin packs are doing extremely well. If I could have done this 100 years ago, I would have done it. But it's wonderful now to be able to put together packs specific to your blood test. And we've always done this. It was just people would go out and buy bottles and bottles of different things. But we could make a vitamin pack where the morning pack has everything that I want in the morning dose. Open your pack, have your breakfast, take your vitamins. Evening pack, you either stay home, go out to dinner, open your pack, take your vitamins with your foods, and you're covered. Then a month after we set you on the pack, we'll recheck to make sure that your low vitamins are perfect, and that creates the best, perfect vitamin levels. So.
Someone just got a question on lithium about what do you call it? Hold on. Let me get the question back up. Like for using it for bipolar and like heavily depressed people, they're basically just asking
it's a medication that's used for that.
Right. They're confused. Yeah.
That's a bigger dose. So they're not talking about the prescription. They're talking about the nutrient lithium orotate and using that in small amounts to help brain function. That's what the study spoke about. But lithium has been used, in much bigger dose as a medication for a variety of disorders. That's a slightly different mechanism.
Hope that cleared that up, guys.
Let's see what else we have here.
A quiet bunch today.
Yeah.
Happy Monday.
Blood pressure fluctuations. A lot of patients come in and their blood pressure might be good at home when they take it in the morning or when they take it in the evening. But when they get to the doctor's office, sometimes it's elevated. I mean, you could have, the whole white coat thing where you're a little anxious getting to the doctor, you're driving, and people out there on the streets are crazy the way that they drive. But we'll recheck their blood pressure after they've been in the office for a little bit. But you have fluctuations all day long of the amount of water that comes in, which helps to control, your pressure, because if extra fluid comes in, didn't get out yet, your blood pressure might be a little bit higher. Magnesium, potassium, calcium, etc. If your minerals are low, the tone around your blood vessels might be tighter. That could raise your pressure. So your hormone levels, how much exercise you do, how well you slept the night before. So there are a lot of variables. But we want to look at all of these things and try to put this into a common sense picture. So for a lot of people that can get up in the morning a little bit earlier and do a little bit of exercise, either walk around the block, around the house, elliptical, treadmill, whatever, doing that exercise opens up your blood flow, and that can keep your blood pressure in a better range throughout your morning. And some people do the exercise in the afternoon and further dilate the blood vessels to accept more blood flow, oxygen, vitamins, minerals, and hormones. So exercise is a great way to train your body to quickly open your blood flow when you need. Correcting your minerals, of course, will help with that. So it depends upon what your body's going through at the time that we can correct so that your blood pressure stays in a great range all the time.
One question, how much does salt really affect blood pressure, or is that overstated?
In some people, it's got a greater effect than others, but, people take in too much salt, too much sodium, way too much. It's estimated that people take in 6,500 milligrams where they should be taking in a few hundred because of all the salty foods. If you look at labels, look to see how much salt is in a food. I'm not just talking about potato chips or things like that. Just look to see how much salt is in the foods, then add up how much you have per day. You'd be surprised. When we do this with patients, most of them are shocked. And then when you back down on that salt, you're not holding the extra water that the salt is creating a requirement for, and then your pressure comes down. Just like a person who needs to lose some weight, if you're holding on water in your fat cells and you start to do the exercise and low carb, you lose the weight, that water goes and your pressure comes down nicely. So,
do things like coffee or alcohol cause long-term high blood pressure or just temporary spikes?
So I know people of every possible background, every combined scenario. For some people, too much alcohol and too much caffeine might keep the blood pressure up a little bit or spiking. For people who eat right, take their vitamins, exercise a lot, or daily, you don't see that. And they can have their cup of coffee because their body's burning right through that caffeine for the activity. A lot of my patients will have a cup of coffee in the morning and put a protein powder in there, a scoop of that. They're getting great proteins, vitamins, a little caffeine from the coffee, and they go for a run or they go for a bike ride or indoor bike or the gym, or you're burning through that and you're making use of the protein, putting that into your system, into your muscles. Similar for people who drink alcohol. If you have a glass of wine with dinner, that's no big deal. And if you're doing the exercise every day, your body is going to utilize and burn up the negative components. I wouldn't be drinking alcohol all the time or in large amounts because that's not good for you. But the healthier your body is, you can vary from that great path now and then without a big problem.
Someone said Mediterranean diet to the moon. Love it.
Yeah, I think it's a great concept. And look at the people who follow that for thousands of years. Those people are super healthy. No junk, no preservatives, no dyes, just good, healthy foods. And it's interesting in that realm, people will have the grains and the carbs and the pasta, but it's pure. It's not GMO or otherwise, and they still will have good outcome. They're not having, tons and tons of pasta and pizza and, ice cream and junk food. But if you're having some pasta throughout the course of the day or the week, it's not there all the time, your body still will burn through it because they walk a lot.
Got it. What is the connection between high blood pressure and kidney disease I've been hearing about?
So your kidneys need to have good blood flow to regulate what's happening in your body. Your kidneys take waste products of metabolism and allow them to go out through your bladder and to urinate out of your body. So there's a regulation mechanism between your kidneys and your lungs and how you breathe oxygen in and you're creating energy. And there are hormones that regulate, along with your brain, your kidney function. So if your kidneys start to go, your blood pressure starts to go up. So that's a pretty common mechanism. Renin-angiotensin systems are involved in this, and angiotensin converting enzyme inhibitors or drugs that are used to inhibit that to lower blood pressure. It's a pretty complex pathway. So for your kidneys to be working less, if you drink a good amount of water, you're kind of diluting your blood flow and decreasing the potential for dehydration. And it's easier for your kidneys to just urinate out an easier amount of fluid that's less concentrated. But if you get dehydrated and you have too much stuff coming in and your kidneys are now having to do more work and you're presenting more concentrated liquid to your kidneys, then they can end up having problems with that. You can see that in people that get dehydrated. Their kidney function, the GFR goes down and the creatinine goes up. So when we get to people to hydrate, it's easier to just flush their kidneys and get rid of waste products of metabolism. Plaque in the blood vessels of the kidneys also creates hypertension. So we're always looking for that through sonogram of the abdomen to look at the blood vessels.
All right. Someone else asking, what about dementia?
So dementia is a common problem. It's more common now than I think ever before because of a great deal of exposure, much more exposure to things that can interfere with and damage your brain. Certainly heavy metals. Aluminum has been documented for many years to be connected to dementia, memory loss dementia, and Alzheimer's. Absolutely. So everyone should be testing for heavy metals, not just a blood test, because the blood's only showing you what recently came in, and it can vary day to day, and you might see no aluminum on one blood test and think you have none in your body, which would never be accurate. And if you do a urine test, which tells what's leaking out of storage, and 21 metals, you get a much better picture of what you're harboring as opposed to just a quick blood test. Also, hormone decline. Your brain and every organ needs vitamins, minerals, and hormones. And we all know people as they've gotten older and their hormones have declined, where they start to lose memory, focus, etc. Usually short-term memory is the one that you lose, and long-term memory, because it's been embedded for years, remains. So we have to test vitamins, minerals, hormones, heavy metals to understand what the brain's going through. Are there certain genetic components? Of course. And some people say, my grandfather at a young age had this problem, or my grandmother, or my aunt, my uncle. That's possible, but you have to understand, in an industrialized world, and exposure to all sorts of chemicals and things, all these diseases are on the rise. And if you look at people who live in these wonderful environments where there's no industrialized mechanism or industry polluting the air and polluting everything else, and they've got that good Mediterranean type diet, they do wonderfully. They're much healthier and even get to much older ages and have great brain function and don't have plaque. I mean, you see this in Europe a lot.
Someone in the chat said, let me live in Tuscany. All my problems will go away.
So
Amen.
I was first impressed with Tuscany many, many years ago when I did my internship. I hadn't gone there, and I didn't go there till much later. But I had there was a great neurologist It would take me a while to remember her name. But she and her husband and a group of other doctors, like 12 of them, would go on these wine and food tours to Italy. And it was the thing where they would just go to Tuscany, go to the first vineyard, and they would go vineyard to vineyard. I thought, wow, that's got to be pretty cool. And she would bring back pictures and, little notes and everything she had. I'm like, wow, this is a brilliant idea. Just go on a tour of Tuscany. Go to every great vineyard and do that sort of thing. And I always remembered that. And then later on, when I first went to Italy, went to Rome, Florence, Venice, and went in around, and I thought about, I got to go to Tuscany. So I went to Tuscany, went to the vineyard. I'm like, oh my gosh, this is what these people were doing every year? And they went to different places, and they went to different parts of Italy, different regions. But like, what a genius idea. Go there to eat and drink. Antinori, which is one of the oldest, if not the oldest, in Italy, makes some of the greatest Italian wine ever. Tignanello, Pian della Vigna, and I know and have some of these things at home. I have to lock them up and put them in a safe place so family members can't go over there and just say, oh, let's have some red wine. Not that one. Wait. No, and we have it. We enjoy it. We have, for special occasions, we have some terrific wines. I have a good friend of mine who's got a wine cellar as big as my medical office. So, any issues or questions on wine, he's the person to ask. But, yes, it's great to have trips like that because you could absorb yourself in what's been going on at these vineyards for so many years, for hundreds and sometimes thousands of years.
You always give me the bug. You always give me the Italy bug.
Yep. I got to go. I got to go in October somehow. It's a nice month to go. Not too hot, not too cold. I have a good friend, David, who goes back and forth, works there, works in D.C., so next time I chat with him, I'm going to book a date.
I'll see you out there. Arrivederci.
That's right. All right, so we're at an hour, so we've covered a lot of topics. Having a lot of fun here.
Always.
For those of you who would like to call the office, do so. Learn about the practice, 516-794-0404. And the website's drcalapai.com, drcalapai.com. Ask us about remote patient monitoring for our Medicare patients. We could monitor them at home and really track and optimize their health. And our vitamin packs are working brilliantly. We have people calling in from other states. We have people calling in from all over the place because they want to have the telehealth visit, have the blood work done, especially for vitamins and hormones, review that via telehealth, and then we can put them on the vitamin recommendation. Brilliant and easy. There's no reason why anybody couldn't do it. So that's why we're opening up to anybody who wants to do that. Just give us a call and we'd set that up. All righty. Thank you for listening today. God bless you all. Have a wonderful day. We'll be back again on Friday and then again Saturday.